Have you ever caught yourself hiding behind a cap on outings, in photos, or even while meeting friends just because your hair doesn't feel like you anymore? Meet our patients who faced the same challenge for years. Patient 1, dealing with Norwood Grade 2 baldness for nearly 4 years, discovered us on social media. Daily hair fall while combing and the constant need to wear a cap made socializing uncomfortable. Inspired by our YouTube results, he took the step, and in just 7 months, his look and confidence completely transformed. Patient 2, a video creator facing Norwood Grade 3 baldness for over 5 years, felt his receding hairline was making him look older on camera. Caps became a necessity. After seeing our real patient results online, he chose QHT, and within 10 months, his overall look has changed. If you also want to achieve similar results than right now, book a consultation with our experts. In this video, we share their complete hair transplant journey, from planning and hairline design to progressive hair growth. Watch till the end, and don't forget to subscribe for more real transformations and expert insights. Patient 1, who had an early-stage baldness, primarily marked by a receding hairline. Over time, the position of his hairline had shifted backward from the frontal area, causing an imbalance in his overall facial frame and making the forehead appear broader. The recession had also progressed from the temporal sides, which made the frontal region look sparse from the corners. However, the remaining scalp maintained healthy and uniform hair growth, which meant there was no need for any surgical intervention in those areas. Most importantly, the donor area was healthy and dense, an essential factor for achieving natural and successful hair transplant results. In patient 2's case, the hairline had receded significantly toward the mid-scalp, making the forehead appear noticeably wider. The frontal area had become completely sparse, and this mid-stage baldness had a visible impact on his facial proportions. As a result, his overall appearance began to look dull and aged, and styling his hair became increasingly difficult. Being a content creator, appearance played a crucial role in his professional life. The positive aspect was that the remaining scalp still had healthy hair growth, eliminating the need for any surgical intervention beyond the frontal region. The primary requirement was to restore the frontal hairline and density, which was well supported by his healthy and dense donor area. If your hairline is also receding, you can simply share your pictures with us. Our doctors will help you understand your current stage and guide you towards the best treatment option. Once the detailed scalp assessment was completed, our experts moved on to the next step, which is hairline design. A well-planned hairline is the foundation of natural-looking results, as it directly impacts facial balance and overall appearance. To begin this process, both patients' heads were carefully shaved to clearly visualize the extent and pattern of baldness. The scalp was then thoroughly cleansed using a medicated solution to ensure proper hygiene and prepare the area for precise planning. After this, the hairline was designed. For patient 1, the hairline was planned by keeping his facial proportions in mind and accurately measuring the distance from the glabella point. Along with this, the frontal area was carefully outlined and the temporal angles were precisely marked to restore a well-defined hairline. Since the remaining scalp showed healthy and dense hair growth, no additional markings were required in those areas. For patient 2, the hairline design was approached with equal precision but tailored to his round face shape and facial symmetry. Measurements from the glabella point helped create a soft, natural hairline that complemented his facial structure. Along with this, the affected frontal area was outlined and the small patchy area with absent follicles was also marked separately. These detailed markings provided the surgeons with a clear roadmap of the bald areas and served as essential guidelines during surgery, ensuring accurate graft placement and optimal density. After finalizing the hairline design, our team immediately began the surgical procedure. First, we then administered local anesthesia to ensure the procedure remained completely painless and comfortable throughout. Once the anesthesia took effect, our experts created micro slits in the affected areas of the scalp. They designed each slit with precision, carefully following the patient's natural hair growth, direction, angle, and depth. This step plays a critical role in achieving natural-looking results. Next, our surgeons performed extraction and implantation simultaneously using the advanced QHT technique. This method helps preserve follicle vitality, reduce graft out-of-body time, and significantly improve graft survival. For patient 1, our team implanted single and thin hair follicles in the hairline zone to create a soft and natural appearance. To enhance density and provide a fuller look, they strategically implanted double and triple hair follicles in the frontal area. In this case, a total of 2,510 follicles were implanted, all precisely extracted from the patient's safe donor zone without compromising donor density. For patient 2, the team followed a customized approach. They implanted single and thin hair follicles along the hairline to form a smooth, rounded contour that suited his round face shape. To restore balance and volume in the frontal region, they implanted double and triple hair follicles for optimal density. In this case, the surgeons transplanted 3,200 follicles, carefully extracted from the safe donor zone while maintaining long-term donor area integrity. Our team executed every step with precision, expertise, and advanced planning to deliver dense, natural, and long-lasting hair transplant results for both patients. If you want to know more about the procedure, comment hair transplant. After the transplant, both patients visited the clinic multiple times for follow-up sessions. During these visits, our experts closely monitored the healing of the scalp and carefully assessed how the transplanted grafts were responding, ensuring proper recovery and optimal hair growth. At the 1-month follow-up, our experts observed nearly 70% shedding on patient 1's scalp. This shedding indicates that the transplanted follicles have successfully settled into the scalp and entered the resting phase. This stage is essential as it prepares the follicles for stronger and healthier regrowth in the upcoming growth cycle. During this phase, the patient's native hair continued to grow at its natural pace without any disturbance. The donor area showed excellent healing, with the skin fully recovered. Overall, the scalp condition remained healthy, confirming proper graft survival and a smooth post-transplant recovery process. 2 months after the transplant, patient 2 visited the clinic for his first follow-up. During this visit, our experts observed nearly 90% shedding in the transplanted area with mild redness present there, which naturally fades over time as healing progresses. At this stage, the transplanted follicles had successfully entered the resting phase, allowing the roots to strengthen beneath the scalp in preparation for healthy regrowth in the coming months. The patient's native hair follicles continued to grow at their natural pace without any disruption. The donor area has also healed completely without any inflammation. During the first and second month follow-up visits, both patients underwent their first PRP therapy session as part of their post-transplant care plan. This therapy plays a crucial role in stimulating the transplanted and native hair follicles by improving blood circulation to the scalp. Enhanced blood flow helps deliver essential nutrients and growth factors to the follicles, strengthens the roots, and supports faster healing and healthier hair regrowth. If you have any questions regarding the shedding phase or PRP, then drop them in the comments section. Our experts will guide you. 5 months after the transplant, both patient 1 and patient 2 visited the clinic for their next follow-up. During this visit, our experts observed that the shedding phase had fully concluded and the transplanted follicles had successfully transitioned into the active growth phase. At this stage, new hair growth appeared stronger and more mature. The hairline had started taking a well-defined shape, beautifully framing their facial features and restoring overall facial balance. In the frontal area, dense and voluminous hair growth was clearly visible, blending seamlessly with the patient's natural hair and creating a uniform, natural look across the scalp. The overall scalp showed consistent and even hair growth, which significantly enhanced their appearance and confidence. The donor areas had healed completely and became virtually undetectable, with no visible signs of extraction. For both patients, the progress at the 5-month mark appeared remarkably similar, reflecting healthy follicle survival, proper growth direction, and a successful transplant outcome. If you are also ready to bring back your hairline and are looking for the best clinic, then right now, book a consultation with our experts. 7 months after the transplant, patient 1 shared his fully matured hair growth progress. At this stage, the hairline had settled perfectly and now framed his facial features in a natural and balanced way, giving him a noticeably younger and more energetic appearance. The frontal area showed dense and voluminous hair growth, creating a strong and well-defined look that blended seamlessly with his native hair. The overall scalp appeared full and healthy, with uniform hair growth and improved texture. With the restoration complete, patient 1 can now style his hair freely and choose any haircut according to his preference, further enhancing his overall appearance and confidence. 8 months after the transplant, patient 2 confidently went for his first haircut of choice, marking a significant milestone in his hair restoration journey. By this stage, the transplanted hair had grown to sufficient length and strength, allowing him to style his hair freely. The texture and thickness of the hair had improved noticeably, and the overall growth blended naturally with his existing hair, clear proof that the follicles had matured successfully. At the 10-month mark, patient 2 visited the clinic for his scheduled PRP session. This time, he walked in with a completely new hairstyle, reflecting both his restored hairline and renewed confidence. The hairline appeared perfectly defined, soft, and natural, providing excellent facial framing and enhancing his overall appearance. The frontal area showed impressive density and volume, while the rest of the scalp appeared fuller and evenly covered. The hair growth looked healthy, strong, and well settled, with no visible gaps or patchiness. This stage highlighted a balanced combination of natural hair direction, proper density, and long-term graft survival, showcasing a successful transformation for patient 2. Patient 1 initially had early stage baldness with a receding hairline that disrupted his facial balance and made the forehead appear broader. 7 months after the transplant, his hairline became well defined and natural. The frontal area gained dense growth and his overall appearance looked younger, fuller, and more confident. Patient 2 initially had mid-stage baldness with a significantly receded hairline and sparse frontal area, making his forehead appear wider and his look aged. 10 months after the transplant, his hairline became perfectly defined. The frontal area gained strong density and his overall appearance looked fuller, balanced, and youthful. Both patients achieved highly impressive results despite starting at different stages of baldness. In both cases, the hairlines appeared natural and well defined. The frontal areas gained excellent density and the transplanted hair blended seamlessly with the native hair. At the 7 and 10 month marks, both achieved outstanding results that will continue to improve naturally for a lifetime. If you also want the impressive results with painless surgery experience, then right now, book your slot. Give a call or drop a message, our team will reach you out. Or visit any of our branch
मॉडल कॉलोनी हरिद्वार D15 आउटर रिंग रोड प्रशांत विहार सेक्टर 14 रोहिणी दिल्ली नर्सिंग होम प्लॉट संख्या 3 सेक्टर 46 गुरुग्राम हरियाणा ऑपोजिट होटल पार्क हयात रोड नंबर 2 बंजारा हिल्स हैदराबाद तेलंगाना।
हेलो फ्रेंड्स, अगर आपने अभी तक हमारे चैनल को सब्सक्राइब नहीं किया है तो प्लीज इस वीडियो को लाइक कीजिए, शेयर कीजिए और हमारे चैनल को सब्सक्राइब कीजिए और ध्यान रहे बेल आइकन दबाना ना भूलें, जिससे हमारे हर वीडियो का अपडेट आपको समय समय पर मिलता रहेगा।